So now we talk a little bit about the story of I-7. So this is a story of basically me, a young dreamer who aspired to make it big. I think everybody at that age is like me. Everybody dreams that he would like to make it big one day. I was just like any other normal ophthalmologist, passing out my MS from Amritsar 35 years back, and I moved to Delhi with this dream. So I took a leap into practice. That was in 1991. My wife is also a doctor, not an ophthalmologist, and she took a permanent job in a government hospital in ESI, and that became our financial security. Now we knew there is one earning member who would get a fixed salary, and I could afford to take risk and experiment. So I decided to take the plunge, and we launched Chowdhury Eye Center. That time it was very typical that every doctor used to start his practice by his own name. I was just one of them. So my father was a retired army officer, and he proudly said, "Son, I have given all my children the best of education. Now each of you have to charter your own course." I think that is what all parents say. Some children are lucky, they are born with a silver spoon, but most of us at that time came in from middle class families and they had to charter their own course. He gave me a purse of just 25,000. He says, "That's all I can give you." I bought a second-hand slit lamp, a retinoscope, a ophthalmoscope, a trial set, and he gave me a room in the house to set up the practice. That's it. And I waited for my first patient. That was the big challenge. How is that first patient going to come in? So this is the center I was in. There's a small little shed there. That was the entry to my room where I started practice in Daryaganj. The rest of the house was on rent, and well, we had a humble beginning. So, how do we get the first patient? That is always a big question mark in the mind of every young ophthalmologist who starts practice. The standard sources are: you talk to the GPs of your area, you talk to the optical outlets of your area, you talk to the chemists of your area, you become a member of the local medical associations. I became a member of the Delhi Medical Association, Central Delhi, and I became the secretary. I got to know all the local doctors, and some patients started trickling in. Then I realized that you have to embrace new technology, and the new technology gives you a competitive edge. In 1995, just 4 years down the line, I was still very fresh. The buzz around LASIK started. Nobody had a LASIK at that time. One, two doctors were giving presentations of the things to come. RK was still in vogue. And the talk started that somebody is going to install LASIK in Delhi. And the machine was costing just over 1 crore, but that time 1 crore was a phenomenal figure. 1 crore, you couldn't believe it. So we convinced in Daryaganj, where I was practicing, there's a nursing home called Sanjeevan Nursing Home, and I somehow convinced him that this is going to be big time in the future. And he agreed to invest, and we gathered a team of 5 people, and we got moving. We put up the Nidec excimer laser, and then the other 4 were stalwarts. They were doing huge volumes. I was just a young fresher into the system. And I was wondering, how am I going to get into the mainstream? So I had to project myself as a LASIK surgeon. And I followed a fairly regular protocol which people follow. I reached out to the medical reporters of newspapers. I used to sit with them in clubs, have drinks with them, spend hours with them, give them the whole topic to write, and then they used to publish it. And since the topic was new and interesting, I was fortunate to get articles in Times of India, Hindustan Times, Indian Express, The Hindu, Navbharat Times, India Today, The Week, scores of magazines and newspapers. Overnight, I was a LASIK surgeon. Then it has to be sustained. It's not that you can do one line of promotions and that's the end of it. So we bought column space, weekly column space with a couple of magazines and newspapers. And that we ran for not only months but years together. Question answer formats. The patients asking question, we giving them an answer. So there was a connect, and my clientele started going fast upwards. Then one day, when I was in Guru Nanak Eye Center, we had a house surgeon, Sanjay Malik, son of Dr. S.R.K. Malik. You all know his name. Even Sanjeev Malik is no more now. He said, boss, you have to come into academics to be visible. Somehow that line got into my head, you have to be in academics to be visible. So I decided to go about it. I decided to be at the forefront of technology. I had that passion to acquire the latest equipment. I still have that passion now. And I had presentations on all new launches. People started recognizing me as somebody who is tech savvy and speaks well on new releases. My graph started moving further. And then at that time, what Dr. Tityal was talking about, there was an era coming up of subspecialties. Ophthalmology was getting into 7 subspecialties, these ones. And I felt that now the time has come for the next big jump. And we launched I7, the story of which I'm telling you right now. So we realized that Chowdhury Eye Center cannot go on now. It cannot be a one-man show. It has to be a team of doctors. It has to be that the doctors are working for an organization and they're not working for Sanjay Chowdhury. So the name had to be totally different. We had to shelve Chowdhury Eye Center and make a brand name. Now the question was, what should be that brand name? So we had lots of discussion that are the important ingredients of a brand name. So the brand name should be short and catchy so that you can remember it. It cannot be a long 1, 2 words or 3 words. It should be alphanumeric so that it cannot be copied. So you just can't have some advanced center or laser center or laser vision. These are general words. Alphanumeric cannot be copied. So you cannot fringe on the rights of that brand. It should have something which gives an idea that this is something to do with eyes. And it should represent the 7 specialties, subspecialties which we are talking about. So we had so many combinations, almost 20, 30 combinations. But finally we settled down, and what was born was I7 Eye Hospital. Short, sweet, alphanumeric. You hear it once, you cannot forget it. Now, the next challenge. We have done this. We have set up a team. We have the doctors with us. And now we have to reach out to the people of Delhi and NCR. So the next step was that we divided Delhi and NCR into 5 zones and started planning. a north zone center, a south zone center, a east zone center, a west zone center. In central Delhi we were, and that led to what we became a chain of eye centers in Delhi and NCR. We are still expanding. There's a big hospital coming up in Noida. Yeah, just a minute. Just a minute. Yeah. Okay. So I'll just talk about the last slide. Just a minute. So this is our present scene. This is our center, the main center. We set records in the Guinness Book of World Records for doing the maximum conjurer surgeries in a day. We set a record for doing the maximum ICLs in a day. We started the I7 Kids Center. We kept thinking of ideas, we kept implementing it, and till now we have felt that our journey has been really good, but we are not stopping. The process continues. Thank you so much.